Now, speaking of healthcare, there is a place in Omaha with a completely different approach to keeping you healthy. At Think Whole Person Healthcare, this team treats you as the whole person, not just a set of parts.
It truly is practicing medicine in a team fashion. Something that I wasn't exactly used to before.
Team-based care and patient-centered have been buzzwords for the last 5 to 10 years. But this is the first place that I've ever worked that I've actually seen a true commitment to patient-centeredness and to team-based care.
They feel secure that they can come to one building, get mammos, x-rays, more sophisticated radiology, labs, pharmacy.
Our team consists of the physician, the nurses, and the pharmacists. We work very closely with everybody to benefit our patient. So one of our patients came in to visit his physician, and they were very confused about the medication. They are on a lot of medication, and the husband was managing the wife's medication. It was not working for them. We organized their medication, make sure all their medication is the correct medication. We put them in a pouching system that it gives them the time, the date. It has changed both their lives to the better.
Everything that we do here, we are bringing back to the patient and asking ourselves, does this make the patient experience better? Does this make the outcome for the patient better?
We have a full lab, but then on the imaging side we have x-ray and we have CT and ultrasound and mammography and bone density scanning. Typically we'll come in for a lab appointment first, so about 30 minutes before you see your doctor, and by the time you're in seeing the doctor, they're already going to have those results for you. So it's all about being able to work with you and talk to you about your results. That way, if there are follow-ups needed, then they can do that right at the time when you're there. They don't have to wait, call you back, a day or two. It's 30 minutes and you've got your results.
So we have our MAs and LPNs and RNs that work on the floor. We also have our care coordination team that takes care of our chronically ill patients, and then we also have our triage staff that are meeting the needs of our patients 24/7. Our nurses are happy to be a part of a healthcare system that is changing the way that healthcare is done.
So are they staying healthier? I believe so. I think we have the data to prove that.
We almost always have same-day openings as well, so if you come in because you're sick, they'll get you in same day.
It's really nice when they come in and they talk to me about, oh, Lisa, your nurse from care management called me. She calls me like every few weeks, and they really feel like they're cared for and they have an access or an avenue to talk to us.
We are lucky to have this patient-centered care right here in Omaha.